practitioner today. I'm just gonna wash my hands. Can you tell me your name and date of birth, please?
Ada Brooks, 01/17/01.
Okay, great. And how can we help you today?
I'm just having my yearly checkup.
Your yearly checkup? Okay, great. Are you having any problems or concerns that we need to know about, or any changes since the last time you were here?
Nope.
Okay, so at this point I would continue to ask her medical information about her history, any medication changes, all of that, which will be documented. So now we're just going to go ahead and continue with the assessment. So we're going to get your height, say we did that and that was 5'8" and your weight was 120. Okay, and then also when we do that, we would take you to the eye chart and have you do an eye exam. So I want you to hold that over one eye, and I'm going to hold this about 6 feet away, and I'd like you to read the lowest line that you can read.
It's LTFFH.
Okay, and then with the other eye?
LTFFH.
Okay. Okay, so that's checking cranial nerve number 2, and you have 20/20 vision. Okay, and then also let's go ahead and do your blood pressure and your other vital signs. Let's do your left arm here. Okay. I'm sorry, 90 over 58. It's great, good. Okay, let's take this off for you. Okay, and then I'm just going to check the pulses on both your hands for a second and check for symmetry. They are 2+ and regular. So let's go ahead and get a rate. So let's just say the rate is 82, okay? And now let's go ahead and check your temperature. Okay, great, that's 98.6, good, okay. Now I'm gonna go ahead and start with the assessment. I'm gonna start with a couple questions, okay? Can you tell me what month it is?
April.
Okay, and what year is it?
2019.
Okay, and where are you?
Bowling Green, Kentucky.
Okay. And who's the president?
Donald Trump.
Okay, great. The next thing I want to do is I'm going to put my hands on your head and your scalp and your skull and just kind of feel around. Is that okay? Okay, and so I'm just feeling to see if you have any lumps, and you've got a nice little French braid here, so I don't want to mess that up. But have you had any falls? Have you bumped your head? Any car accidents? Anything like that?
No.
Okay, great. Now I'm going to apply a little bit of pressure in some of the areas of your sinuses, and just let me know if there's any pain or discomfort. Okay. Okay, we'll push up here a little bit. Okay. Can you open your eyes for me? Good. Your sclera nice and white. Your conjunctiva is nice and pink and moist. And then everything looks very symmetrical. Your labial folds, your mouth, everything is very symmetrical. Great. I'm just going to put my hands on the side of your jaw. Can you open and close again? Good, good. Now I'm just going to feel your lymph nodes, okay? So I'm just going to name them while I'm doing it as well. This is your preauricular, postauricular, occipital. This is your jugulo-digastric. This is your superior cervical. This is your deep cervical chain. This is your supraclavicular. Okay. Oh, and also we have the submandibular and the submental. Good. Okay. All of that's wonderful. Okay, so we're going to check your range of motion with your eyes, okay? So with my pen, I want you to keep your head straight and then just watch the pen with just your eyes, okay? Just try to follow it with your eyes. This is the cardinal signs of gaze. This is checking cranial nerves 3, 4, and 6. And good. Now I'm also going to have it go closer to your face. Just watch the pen, okay? Okay, good. And convergence is intact. Wonderful. Okay, the next thing I'm going to shine a little bit of a light in your eye. Okay, so I want you to just look straight ahead. Okay, I'm just checking for pupillary response. Okay, good. Good. They're equal and reactive. Okay. So the next thing I'm going to do is I'm going to turn out the lights, and then I'm going to check for the red reflex. Okay, so since we can't really do that and it's daylight, I'm just going to go ahead and we'll just pretend. Okay, so I want you to just look look ahead. Okay, and I'm just gonna kind of hold your head still there. Okay, great. Okay, let's do the other side. Okay, great, good. We have perla, which is good. It's a good finding. So the equal, responsive to light, the red reflex is there. Okay, so the next thing we're going to do is check your ears. Are you having any problems with hearing or any pain or discomfort in your ears? No? Okay. Looks like you got your ears pierced a couple times. Okay. So now I'm just going to look into your ears, okay? So just kind of hold still for me here. Okay, good. Nice and gray and translucent, pearly, shiny. Good. That's what we want to see. Good. Good. Okay. So while we're checking your ears, the next thing I'm going to do is I'm going to just check the vibration and also the air conduction. So this is checking cranial nerve number 8. So I'm going to get this to vibrate, and it's going to go right on top of your head. Do you hear it on both sides equally?
Yeah.
Great. Okay. Now I'm going to put it behind your ear. Let me know if you hear it.
No, I do.
Okay. Do you hear it now?
Yeah.
Which one is louder?
Second one.
Okay. Let's do that again on the other side. Oh, the other side. You hear it?
Yeah.
Okay. And now?
Yeah.
Which one is louder?
The second one.
Okay. Good. So that means your cranial nerve number 8 is intact. Great. Okay. So now this is going to check cranial nerve 5, 7, and 12. We're just going to make sure you can make a bunch of different faces at me. Okay. So the first one was smile, so you can do that. Okay. Now raise your eyebrows. Good. Okay. Now like squint your eyes, like scrunch up your face. Okay. Good. Now stick your tongue out and move it. Okay. Now puff your cheeks out. Good. Okay. So now I want to look at your neck here. Can you raise your head up? Good. And then your triculis midline. There's your thyroid. Okay, go ahead and put your head down a little bit. And I'm going to have you swallow. Can you swallow? Okay, good. Any trouble swallowing? Your thyroid feels good? I mean, it feels like it's normal size. Now I just want to test the range of motion in your neck. Can you turn your head tilt it side to side? Okay, good. And then turn. Okay, good. And up. And tuck to your chin. Good. Any discomfort with that?
No.
No? Okay. So now I'm going to put my hand on the side of your face and just kind of push against my hand. With kind of like turn into it.
Oh, yeah.
There you go. And then do this one. Good. Okay. Now shrug your shoulders. Good. That's testing cranial nerve number 11. So we're good there. Okay. So now what I want to do is look inside your mouth, and then what I'd like you to do is open up and say ah. So open real big. Say ah. Okay, good. Your buccal mucosa looks nice and pink. I'm gonna look underneath your tongue. Good. Looks like got nice teeth in there. Okay. So the next thing I'm going to do is I'm going to kind of just check your sensory reception. So close your eyes, and when you feel this on your face, just say now. Okay? Just keep them closed.
No. 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 No.
Okay.
No. No.
Okay. I'm just gonna have you, I'll probably just have you sit there and we'll listen to your carotid arteries, okay? Now take a deep breath in, then blow out, and then hold it. Okay, good, breathe, and out, and hold it. Good, 2+, no bruises, that's wonderful. Okay, now we'll listen to your heart. If you could kind of sit up a little bit straighter. Okay, this is your apex, or your aorta. Good. This is your pulmonic. Okay, this might feel a little strange, but this is your mitral. Okay, good. And then her PMI is at the 5th intercostal, maybe the midclavicular, maybe a little over, maybe a centimeter over to medial. Okay, so now let's also let's maybe have you lay back. Let's see if we can get you a little more. Okay, can you lay back a little bit? And then put your head back on something. There we go. Okay, so now I'm just checking for her venous, jugular venous distension. I don't see any. Okay, and now I'm gonna just look at your abdomen. Is that okay if I lift your shirt up? Okay. Cute little belly. Okay, so let's see. I'm gonna listen to your bowel sounds, and then I'm also gonna listen to your aorta, and then also your renal artery. Really? Okay, that's good. I shouldn't really hear anything, but now we're gonna listen to your bowel sounds, okay? I'm just going to press a little bit. Do you have any pain or tenderness anywhere? Okay. Okay. Take a deep breath in for me. Okay, and out. Okay. And one more time. Deep breath in. Okay, good. Just checking for your spleen and also your liver. Okay. So I want to have you sit up for me, and I'm going to listen to your lungs. Okay, and while I'm doing this, maybe just take breaths like, okay. Can you raise this arm for me? Deep breath. Okay, good. And let's do this side. Deep breath. Deep breath. Deep breath. Good. Okay, if you can you turn that, actually let's turn this. Actually, just have you turn that way. Maybe all the. Maybe just stand. Yes, let's just stand. Okay, and turn. Okay, good. Now let's do deep breaths. Okay, good. Now with you still standing, I'm just going to have you say 99,
99,
99,
99,
99.
99.
Okay, good. And then I'm just gonna tap on my, hard to get. Okay, good. Okay, good. Okay, so now I want to have you just kind of stay in here, and I'd like you to close your eyes. And I'm just checking your balance. Oop. You're just moving your feet? Okay. Do you feel dizzy?
Mm-hmm.
No? Okay. So now I'd like you to turn that way. Just turn all the way that way. Okay, you can open your eyes, I'm sorry. And then maybe come back a little bit and then lean forward. All the way down, touch your toes. Just checking your spine. Get a little bit of a curvature. Okay, stand back up. Okay, your scapulas look just about even. Yep, just even. Your shoulders, even. Okay, now I'll have you go ahead and sit back up on here. And then we're going to check your reflexes. So I'm just looking at your skin on your legs, and I'm going to check your pulses here. Okay, those are equal. Checking your tibial pulses on both sides. Okay, and then we're going to check your, this isn't a very good visual. Okay. Still, can you scoot back just a hair? Okay. Okay, so we're gonna just check your okay, good reflexes here. Okay, good, a little bit of movement. Okay, let's check your, and just have you kind of relax. Hold your arm out a little bit. I don't think I have it in the best angle. Okay, just kind of relax. There we go. Okay, let's try this one. Relax it. Just kind of relax it. There we go. Okay, I see you have some eczema and maybe even another little rash there. Let's look at your skin over here. Okay, good. And then I'm just going to look at your capillary refill. Less than 3 seconds. Good. And this side. Okay. And then we're looking at our feet. Capillary refill. Okay. Good. And this one, looking at our feet. Okay, good. Okay, now we're going to test your strength. Okay, so what I'd like you to do is hold your arm up like this in front of you and kind of pull back on just with your arm. There we go. Now push. Okay, other side. Pull back. Good, and push. Okay, same thing with your feet. Let's hold your one of your feet up. Okay, and then I want you to push against my hand. Okay, and push against my hand. Good. And this one, push against my hand. Push against my hand. Good. Okay. And I believe that is it.